around the table this morning and let everyone quickly introduce yourself and tell me one thing you hate about the cold. One thing you hate about cold, and we'll start with Michelle.
Oh gosh. Well, right now I told people this. Right now, what I hate about the cold is that my son is 5 and doing the male bravado thing and doesn't want to wear gloves or a hat into the cold or even sometimes pants. So right now I hate the cold because I'm afraid it's going to kill my son. There we go.
Great.
Jennifer Banyan. I hate when I'm hiking and my foot goes all the way down to my knee because the snow is not packed and I didn't expect it.
Ashley Nolan. I'm with the Colorado Department of Education, and I work in the Office of School Nutrition, oversee summer meal program. The thing I hate about the cold is that once I'm cold, I'm cold for the rest of the day. Morning, everyone. That's CHS. I am from the South. I think I said last time, so there's a lot I just like about the cold, but mostly it's my toes going cold and staying down for the rest of the day.
Bob Book, Colorado Center on Law and Policy, and I just can't keep my
Maddie Philly, American Heart Association. I would say cold toes because I love it. I love outdoor sports actually in the winter, but when your toes go cold, the rest of you is miserable, and that's very sad. So maybe one of these days I'll get boot warmers because I say I'm going to do that never.
Hi everyone, Alexis Waitman with Colorado Health Foundation. Sorry, we're a little cozy in here today. What do I hate about the cold? I actually really like the cold, but opposite of Michelle, I have a 3-year-old and a 5-year-old who complain nonstop about how cold they are, and it's really challenging to get them in all their snow gear and their car seats, and it takes like an extra 15 minutes to get out the door. Always running late.
Kevin Warner with Trailhead Institute. I would say I also kind of like the cold. I like the winter, but one is probably shoveling the driveway and sidewalk. You just get home and want to relax, and that's kind of one extra thing on your list. So.
Even if it's walked on already.
Yeah, right.
It's hard.
Hi, Leslie Scotland Stewart with Project Angel Heart. I think it just makes me eat more baked goods and drink more coffee.
Yes.
That's bad.
Well, starting to back off.
I'm being with consumption literacy projects, and I don't know, I'm a procrastinator, and so I end up leaving the house really late anyway, and it's cold and snowy like this, and I'm extra late. It's frustrating.
Hi, I'm Aditi Ramaswamy with Children's Hospital Colorado. I'm assuming that's
What you hate about
what I hate about the cold. Okay, I don't hate the cold or anything about it. All I dislike is when I'm not dressed well enough to handle it.
Ellie Garrett from Workgroup, Colorado, and this actually just happened to me yesterday. I opened the car door and all the snow flew across. Of course, you've got like the wet car seat that you can't do much about. So really that would be really thing is like that first, like I gotta get the scraper and I know all the snow is gonna go in.
Eric Moore, Center for African American Health. I would say probably my heating hand get cold the quickest, so I'm kind of playing that game with now and now my body's starting to freak out, but so I would say mostly just playing that game in the car, just trying not to sweat and then also freeze at the same time.
Abigail Kessner with CDPHE, and I'm the same. I hate cold.
Excellent.
I'm Andrew Stricker. I'm with Trailhead Institute, and I really like the cold. Scraping the windows.
Oh, yeah.
I avoid that. Great. And we had some other folks come and join the table. What we're doing is your name and something you hate about the cold.
Okay. Denny Cervantes, Denver Alliance for Street Response to Colorado Poor People's Campaign. One thing I guess I hate, I live in Cap Hill, so you can park on the street obviously, and I didn't realize, parking, I would get all the stuff that's pushed off the road. So my whole left side of the car is dirty snow. So yeah, probably.
Great. Someone else who is a
Yeah, I'm Gordon Duvall. I am
member of the Community Research Liaison of the PAC Council. And something I hate about,
The cold. It doesn't have to just be
not
that.
just the cold.
Just the cold.
It's cold.
Great, yeah.
Curtis Robbins with Casa Permanente. I'm finding in my middle age that my nose just gets really cold when I get cold. I can't get it warm.
True.
In the movies.
Great.
I don't know, I kinda like the cold, I don't like the cold pose. And then if I'm out there for a long time, my ears and nose for sure. But I think just not being able to, you can go out, there's not a lot of outside events. I'm not outside. Out, patios at different spots, restaurants.
I think we got everyone in the room, so let me just, we have people on the phone. Kristen, hello. It looks like you've, muted yourself. Is that rescue?
Yeah.
Great. Okay. Oh, okay, never mind. Great, thank you. So, I'll wrap this up since I started it. As I said, I'm Khadijah, and the thing that, I want you to think about what you said today about what you hate about the cold. I'm probably going to facilitate a meeting again sometime in June. And so I'm gonna want you to reflect when it's beautiful and how wonderful and glorious Colorado is on that day, what you said today. So, with that, we are going to move right into yes, thank you. We're gonna move right into our meeting, and we will kick into Michelle Hayes, who is going to update us on what has been happening with our PSA, and I think we communicated with all of you about the public service announcement, that went out. If you missed those communications, Michelle's gonna fill you in.
Great. So I'll start from the beginning with the public service announcement. As all of you remember, not so long ago, we were in a position nationally of a federal government shutdown that was affecting not only federal workers, many thousands here in Colorado, but also folks who receive SNAP support as well as WIC support. There was a great deal of concern amongst the food banks about their ability to meet capacity. Many of them ramped up to provide mobile resources for various parts of their communities. And they were doing that in a time when their fundraising was typically in a lull because it was right after the holidays and people had fatigue around that. So in an effort to try to help them meet need and due largely to the wonderful leadership of our governor, Governor Polis, we were able to very quickly put together a public service announcement that just called on Coloradans to give where they can to help support food banks, who then want to push that out to for the 1,500 local community partners to help get food resources to people who need them. So we started that effort to push the CSA out about a week ago. I guess it was actually a week ago, Friday. And we have had really great uptake from community partners like iHeartRadio, who have been running running a great deal of radio content across the state for free for us, and have also focused in some areas of greatest need in terms of television. We still need your partnership, where you can push out to your network. You'll be getting another email about this, or your organization will be getting another email about this today. So if you can help us with that, that would be wonderful.
No, we're just bringing people in.
The fundraising to date, honestly, has been slow. I think one of the challenges that we had was literally the day that we were able to launch the PSA, to get it taped with the governor and get it launched, was the day the federal shutdown ended. And so the urgency message, while I think is still critical for our folks who need SNAP help, was lessened by the fact that we had fewer federal government employees that people were concerned about. So anyway, we're continuing to work on the effort. We're continuing to make the donations where we can happen, but I just wanted you all to be aware of that. I'm happy to answer any questions that I can about it. The donations page is running off of the endhungerco.org, our blueprint website. And it's running through a Colorado Gives page that Trailhead was able to set up for us. Yeah.
So I don't know if this is the case for others, but like, I know the AHA wants the support, but we can't actually ask people to donate. Is there any language we could use to make them more aware and kind of indirectly send them to that page, but more like about, this is a huge issue?
Yeah.
Like,
Yeah.
I personally would love to ask them, but I know as an organization.
You cannot. Yes, I can craft some language that you could, and I could send it to you that you could look at and see what, and then maybe tweak to make it work.
That would be awesome, because I know I want to post, I know I would love to encourage our social media team to post, but we can't specifically post to say.
Could you post to just encourage people to go to End Hunger Co. to learn how they can do more? Because once they get there, there's a massive button that says donate in front of them.
I think we could if we said something like, the urgency is still real, learn more, something like that. So if you have any facts or stats that we could share and that'd be helpful.
Yes, okay, absolutely. 400,000 Coloradans. Okay, just, 440,000, I'm sorry. We just pick up every day.
And they're starting to run out of benefits now. I was just in Fairplay in a grocery store and saw two people, BBT cards didn't work, so I had a conversation with them. And then the clerk chimed in and said, I also am in the same boat, and it's a very interesting
So
gas stop for me.
That's a good reminder to all of us. Because of the way the federal government shutdown was going and the length of it, many of folks who need SNAP support received their benefits early in January and now need to make them last until March.
Some like to the 10th of March or longer.
Which is a hardship, as we all know. So that's a good reminder to all of us where you can share. We still have thousands of Coloradans now who are still going to need our help and support well through March. Okay? All right. So if there's no other questions on the PSA, we have our friends, some friends of ours on line to talk with us for a minute. But before we dive into that, I just wanted to kind of frame this for you all and give you a little bit of underpinning of why we're doing this today, okay? We have a couple of different organizations who are currently doing work in the state of Colorado around the idea of raising food resources, and they are different in their nature and scope, but I believe that they're all related to all three of the priorities that we have set for this work group's work. So I'll just taking you all back. You'll remember in our early meeting, we outlined promoting community-driven practices and overcoming barriers as one of the priorities. I'm shorthanding them. Ensuring economic and health impacts of hunger and food access are part of community planning, and developing evidence-based marketing campaigns to lift the issue of hunger in Colorado in various ways at both the community level and at that statewide level as well. So all three of these priorities that this work group has set seem to be impacted to some degree by these larger campaign efforts. And so we have a couple of organizations working in these different spaces, like I said, with different focuses to some degree, but sort of also hitting that overarching messages that we thought might be beneficial to you. We've been hearing from the work groups across the board a great hunger for more research and background and what's happening already in the state and how do we join that effort rather than duplicate that effort. And so we thought that it might make some sense to not only as we're asking you all to provide us that research, right, to provide us with what you're doing so that we can make a comprehensive list, but also sort of showing you and allowing you to interact with the work that's already ongoing and ask questions and hopefully get inspired by this work as well. So with that framing, I'm going to ask, first of all, our friends from California to talk to us a little bit. This is the Rescue Agency, and they, as you can see, they're working on a Colorado SNAP Ed effort around fresh fruits and veggies consumption with our partners at CDHS. And they have a very strong national track record of doing this kind of work many different places. So they're going to show you some of what's happening in Colorado, and I think a little bit about some of the work they've been doing in California as well. And hopefully, we're going to hear a little presentation from them. And given the technology issues, if we could hear their presentation and then if you save your questions to the end, unless it's so burning that you must blurt it out, that would be great just to make sure that we get technology working properly and everybody gets to see what they need. Okay, great. So I'm going to turn it over to our friends in California.
Hi, everyone. I'm showing my screen in case you can see it. I'm not sure, but I'm Kristen Carroll. I'm the CEO here at Rescue Agency. So thank you so much for having us present today. On the phone, I've got myself, Shiloh Beckerly, who is our lead researcher working in the California work. I've got Dina Weldon, who is our group account director for all things nutrition across both California and Colorado. I have Stephanie Cavatoni, who is our account director on the California Department of Social Services work. And then I also have Anna Trout and Priscilla Fernandez, both of who support Colorado in both creative development and account management, as well as research. So we're really happy to be able to join you today. And we thought we would just give you a quick overview of Rescue. But my understanding is that you're really looking to understand how research informs our overall process and make sure that you walk away with a clear sense of how we create evidence-based strategies based on research. Does that sound right?
Yes.
Okay, great. Just to take a quick step back, and I promise this will be brief, just wanted to make sure that we're framing who Rescue is. We are a behavior change marketing firm. We've been around since 2001, so we have a 17-year track record working exclusively on positive behavior change programs. We work on health behaviors across tobacco prevention, physical activity, healthy eating, nutrition education, as well as cannabis or marijuana education and alcohol use. With the emerging opioid trends, we're also learning a lot more and involved in putting together opioid prevention and education messaging in a number of states across the country. We have over 180 full-time staff across North America. And one of the unique things about Rescue is that we are a full-service agency. Everything that we do starts with research, which is why we'll be talking about that today. But we have an excellent team of researchers that are PhDs and MPHs that really help us make sure that with any program that we create, we start with a solid understanding and foundation of the target audience, the specific health issue, and making sure that we can really think through what type of intervention is going to create change. And we do this before we develop behavior change strategies or creative briefs. It really informs the entire process. We also do a lot of work with our clients on evaluation, both in-house and then working with third parties to make sure that we can see the impact of our interventions and campaigns over time. We have a strategy team, creative development, account service, and full implementation team, both from everything from a video production standpoint all the way down to grassroots policy change efforts on the ground in certain states. Our client base is primarily state public health departments, so we work with everyone from the Vermont Department of Health to Colorado to New Mexico and many states in between. We also work with nonprofits like the Special Olympics, as well as large-scale federal agencies like the FDA and their Center for Tobacco Products. The type of work that we do, we typically think about it in three different ways. We think about a health intervention, we're thinking about the audience first, but we're really understanding whether or not we need to change knowledge, provide new information or a new fact or a new way of thinking of something that will actually shift a paradigm and allow someone to change their behavior. We also do work, as I mentioned, on the policy side. We do policy work in states like Oklahoma and Virginia. The policy programs can be anything from voluntary policies where, for example, we're working in Oklahoma to create smoke-free bars and clubs where the legislative environment is not favorable to creating smoke-free policies, but yet we're able to convince almost 50 different bars and clubs in Tulsa to go smoke-free on their own. We also work in school environments and have a youth army in Vermont, Virginia, New Mexico, and Louisiana, states where youth actually work on policy efforts to support change, and we do this tobacco-free schools, and we also work on nutrition efforts like alternative breakfast programs in certain states. And then lastly, we also think through how we change norms. How do we shift culture so that behaviors become more difficult or less socially desirable to exhibit? And a lot of our tobacco work actually focuses on changing norms. So these are 3 areas that we focus a lot of our work on. The work that we're doing for California and Colorado right now is focused on the first area in terms of changing knowledge and really providing new information that shifts how people think about nutrition and physical activity. So in California, we're currently putting together, if you go back one slide real quick, we're currently putting together a health communications media campaign. So we are just about to launch new work in April under CalFresh Healthy Living. It is a new brand that will be used in California to communicate and share nutrition education information through SNAP-Ed efforts. That will be a statewide media campaign. It involves everything from television, digital, statewide days of action, and community champions across the state. Go to the next slide. And from a statewide days of action perspective, this is something that's been really important for California. We've been able to not only think through how do we create a large-scale mass media campaign, but how do we involve partners on the ground who are working with specific populations and help them get involved in creating, healthy ways to change their behaviors. So in 2018, we created a Rethink Your Drink Day. It was an opportunity for over 338 different community partners ranging from schools to YMCAs to dentist offices to participate in a Rethink Your Drink program. They would get an event in a box, and we would give them all the tools necessary to have a highly engaging educational day. We earned over 100,000 people that were reached and 1.4 million media impressions. We also coupled that with an online experience that created an opportunity for people to actually look at a menu of options that they drink on a daily basis and choose something new. And so there was an interactive experience that allowed them to think through how they could change their diet. We also created a healthy snack day and also had over almost 400 partners across the state. These have been very easy opportunities for us to engage a lot of stakeholders who want to do something but don't always have the resources to do so. And so it really created an opportunity for us to couple a large-scale media campaign with on-the-ground efforts in a really meaningful way. And then last, I just thought I'd highlight some work that we're doing in Virginia related to nutrition education and nutrition assistance. We are currently working on a campaign and have been for several years called Great Starts with Breakfast, where we're working with schools across the state who are introducing new alternative breakfast models in schools to allow students to take advantage of new ways to have breakfast and increase the number of students in particularly low-income areas that are eating breakfast. This is a fully youth engagement-led program, and we've been able to convert many schools to new models that are increasing the nutrition provided to students across elementary and middle schools. And then last, we've been working on a program called Fresh Spot, where we're increasing the awareness of food deserts across the state and gaining traction with the community members to actually speak more loudly about how important it is to get fresh fruits and vegetables into urban areas that currently don't have them. So that campaign called Fresh Spot has been in market for 3 years. And with that, I was going to pass it quickly over to Dina, our group account director, who wanted to share you a little bit about the work that we're doing in Colorado.
Thanks, Kristen. Good morning, everybody. So for this specific project overview, we're going to get into the meat here, and Shiloh will walk you through research, but there is quite a lot of work that we are doing with our partners at CDHS around this campaign that we wanted to share with you. So we were charged and delighted to work with CDHS on this social marketing campaign. And ultimately, the main goal for the campaign that we're creating together is to increase knowledge and awareness, to influence attitudes and behaviors, or beliefs, and ultimately to promote positive behavior change, specifically focused around fruit and vegetable consumption for the SNAP-Ed target audience. So that's our charge, that's our main focus. And how we do that is really, our strategy is built on these 3 pillars here. So I'll kind of briefly walk you through each one of them. And then again, at the end, happy to answer any questions here. But ultimately, our 3 strategic pillars, number 1 is tailoring and targeting to the SNAP-Ed population. So you can think of this, a big component of this is research, which Shiloh will walk us through. And that's ultimately doing the work up front to understand who we're targeting, who really needs this message, and how we're going to do that. So we're implementing a tailored approach, and that really means that we don't need to message to everybody on every behavior at once. But we're really hyper-focused on that specific most vulnerable SNAP-Ed population. Secondly, our second pillar here is related to creative, if you want to think of it that way. So that's really moving the messaging that we're getting out there from what to how. So many healthy eating campaigns, I'm sure that we can all think of, try to share everything an individual should be doing in a single message. And really our approach here with CDHS is going to center on how our audience can realistically eat more fruits and vegetables within their current lifestyle. So we know that this audience specifically have a lot of barriers within their life, such as access to healthy foods, time, budget, and we want to make sure that we're ultimately reducing the burden on them that they face by not just telling them that they need to be healthy, because ultimately they understand that they need to be healthy, but rather showing them in a very specific and purposeful and relatable manner on how they can actually be healthy. And the third point here is integrating communications with PSCs and direct communication. So this is really all of the local on-the-ground efforts that Kristen just spoke about as it relates to statewide days of action as an example. So this is all centered around creating campaign elements that can be used by other SNAP-Ed partners to really support the outreach on the ground. So we're really targeting where people are actually shopping and learning and eating and working, and really incorporating SNAP-Ed initiatives into the campaign. And the goal there is to really increase visibility and to make the promotions of these initiatives that we're working on a bit easier. So that's ultimately our, in a very high level view, our 3-pillar approach. And I will turn it over to Shiloh now, who's going to walk you into our process around formative research and other research.
Great, thank you so much, Dina. So it has been an absolute pleasure working with the state of Colorado. I can honestly say that in all of my work that I've done to date, this has been my favorite project so far. And I'm going to walk you through really the process of just how we approach research, more so than the specific findings from the Colorado research. So if that is something that you end up wanting more information about, please reach out to me. I'm certainly happy to share some of the nuances of the research findings, but just given time, right now I'm going to focus just on the process so you can understand where our heads are at when we are approaching a topic in a new area like this. So let's just jump in here. When we start with our work in Colorado, as Dina was saying, the main goal here is just figuring out how can we come up with a campaign that's going to resonate with low-income Coloradans, that's going to increase produce consumption. But to get there, we really approach it with 3 different objectives. One thing which makes Rescue a bit unique is that we do tend to put a lot of energy on the psychographic characteristics and understanding those. So when we think of psychographics, that's values, lifestyles, beliefs, things like that might be unique to low-income Coloradans. And then we figure out how do those impact nutritional decisions that are being made. And then eventually we move towards how can we leverage those same values and those same lifestyle habits in a healthier direction. So what was unique about Colorado was that we did come to it from a very strong background. So we were able to build on some of the California research that Kristen was talking with you about. We've been working for the last couple years with SNAP-Ed individuals in California to figure out this exact same thing. How do we improve their nutrition? So we were able to leverage some findings there. And then also CDHS put us in contact with FNV and some of the reports that were provided so that we could really build on the existing research that had been done in 2017 in Colorado, because one thing that's always important is we want to make sure that we're never duplicating efforts and that we're always building on existing knowledge. So with that, we launched into the first phase of research, which is our formative research. Here the focus is really making sure that we're understanding the audience, right? We want to meet the audience where they're at so that we can really cater to them with a message that's going to connect with them. So a few things that are important to us whenever we're figuring out where to do research and whatnot is that we want to make sure that we are reaching individuals from all over the state. Here in Colorado, we were able to do 5 focus group and 13 interviews. This was last September and October. And everyone that we worked with was eligible for SNAP Ed at that 200% level, which I actually believe Blueprint was responsible for getting implemented, so great work there. And then they also had to have a child in their home, spoke English or Spanish, and were the primary person responsible for grocery shopping and meals. So the main thing here is we want to get diverse geographic representation, and we want people in the room who actually reflect the individuals that we're trying to reach. And so that's one thing we were able to accomplish here. When we approach the actual focus groups and interviews, we always have a variety of different components that are both qualitative and quantitative. And so as you can see here, just kind of going through, this is the general approach that we used in Colorado and that we typically use in campaigns, where we have check-in surveys, value surveys, we have discussions about everything from personal values so we can really understand our audience, to also some of those more explicit discussion topics about what are these barriers to nutrition for our audience. And then we also go into testing existing campaign materials, again, because we don't want to reinvent the wheel. We want to make sure we're building on what is out there. So another thing that we do is we like to organize our thoughts using different existing frameworks. So for nutrition, we have found this framework to be something that's really useful. What you're looking at here is Satter's hierarchy of food needs. If there's any fellow psychology geeks in the room, you might know Maslow's hierarchy of needs. And Maslow is a very famous framework that suggests that before you can deal with things at the top of the pyramid, like creative expression, you have to have everything at the bottom of the pyramid dealt with. And so there, that might be, warmth, food, those really basic things. So this approach is very similar, but in the world of nutrition. And so here it's saying that basically, before you can worry about things at the top of the pyramid, like instrumental things your food can do for you, like make you feel energized, you have to make sure that some of those basic things are taken care of, like having enough food. And that's definitely something in your wheelhouse there. But we found this to be a very useful framework. So basically what we do is we go through all of the different aspects of the focus groups and interviews, and we synthesize all of that information. So we look at all of the quantitative data that we got from the surveys, all the qualitative discussion that happened, and then we're able to start seeing different themes. So in the Colorado research, many different themes emerged. One of the many themes that emerged was convenience as a priority for our audience. And so you can just see here quotes like this bottom one here from one of the male participants in Denver. He said, when you're working 12, 14, 16 hours a day, you don't have time to get home and cook something super fancy. It's impossible. And so that just like echoes kind of what we were hearing from our audience with regards to convenience. But again, that's just one of many themes that we saw. We're able to then look at all of those themes and just kind of do an overview of the nutritional priorities and where our audience is at. So one thing that was really unique to Colorado that we didn't see as much in California is that there was a huge focus on preventing food waste. And so again, that was something that we took into consideration with the recommendations we ultimately made. We also had a tips and swaps component of the focus groups where we tried to understand, what things are they actually open to swapping in their nutritional, world. And for example, here we found that people were really open to swapping apple pie for things like apples with cinnamon, possibly dipped in peanut butter, which is something we actually ended up using later on. We also tested a variety of pre-existing ads. Here you're just seeing still images for the various English language ones that we tested. We also tested Spanish language ones. And something that's just important to know here is that, again, if there was an existing ad that really connected with everyone, we could possibly see if there's a way to leverage that partnership. In this case, none of these specific ads really did connect with the audience the way they were, but what we were able to do in discussion is understand which pieces of it connected with people. So positive tone in the ads was really well received, but in some of them there was like jarring music that was seen as somewhat aversive. And so we knew then from that as well to avoid those kinds of things in creative development. So from there, I pass it off to another internal house team, which is our creative team, which thank goodness, because there's nothing about me that's creative. But I am able to then tell them what I've learned from the first phase of research that might help inform brands and logos. So again, in Colorado, we learned Local is important. People liked images of mountains and plains. They liked fruits and vegetables might be well received as actually part of a logo, and simple and clear. All of those kinds of things emerged during formative. And then there's also a variety of things that we use to inform the creative concepts. So that, I mean storyboards, which are like really basic versions of flagship videos, which could be rolled out. And so you can see, for example, one of the 3 creative concepts that was developed for Colorado is one called Healthy Our Way. And that one really focuses on easy solutions, taking affordable, explicit recipes, and figuring out how those can work for Coloradans. So this, again, is the ultimate concept that we ended up recommending because it was very well received in focus groups. But this is the Healthy Our Way concept. And again, this is just one of 3 that was tested in Colorado. But the idea here is that the trendy version of health is something that just our audience does not connect with. They're not going to be going hunting down green juice or anything like that. Rather, they want quick, inexpensive solutions. They don't want to be worried about things like food waste, and they want to see how this really fits into their life. So with all of that creative development going on, I have the luxury then of just sitting back, letting them do their magic, and then I get to test it in the next phase of research. And so that's what happened here. Unlike the first phase of research, at this point, we're not so focused on trying to understand our audience. We're more just trying to see what brand names do they like, what ones do they not like, what images do they like, and why. So again, we try to get a diverse representation of the state that reflects our target audience in this next phase of interviews and focus groups. And then we launch into brand name testing. So for this specific project, we tested 3 brand names. And the first one here that you're seeing at the top, Eat Better Together, was something that was very well received by our audience. For each of those brand names, we test 2 logos. You can see on the left column here, those are the first choice logos that were selected for each of the different brand names. And then on the right, you can see the one that was not selected. So you can see here in the top left, that was the logo that was currently preferred for the preferred brand name. And then with that, we're able to kind of dig in a bit more in discussion and figure out, is there some way that we can make this better? Is there something about it that the audience isn't liking? And so in this case, there was a lot of comments about it feeling busy, the way it was right here. And that although they love the mountains, they felt like it represented Colorado, all those things we were really trying to get at, we were left with the task of, is there a way to simplify it and make it even better? We also tested the storyboards. And again, you can see the black and white still shot there. That just shows the participants in the focus group an idea of what a final produced ad might look like, but we're not quite there yet. And so we're able to get feedback and incorporate that feedback. This is one of the spots that was really well received. In this spot, the female character is showing and demonstrating different easy, healthy snacks that she can share with her family. But at this point, we're also able to get feedback from the audience, which is so great. So here, one of the key suggestions that they had is, in the original spot, only the female character was actually helping make the snacks. And they said that they really wanted, in focus groups, it was discussed that they wanted the entire family to be involved in that process, and it would be even better received. So we're able to pivot before we produce the ad. And again, there's different quotes here associated with this. And there was a second spot as well. This one was originally tested in Spanish and also is one of the favorite spots. So from here, we just have to make some recommendations about the campaign direction. For Colorado specifically, it was decided that we wanted to move forward with the brand name Eat Better Together. You can see on the bottom though, the original logo that was tested on the left, that ultimately is ending up looking more like something on the right, which again is taking into consideration the feedback that we received directly from the people we're trying to reach. We're also moving forward with the Healthy Our Way spots. So these again were very well received. People liked that in this spot there's specific simple recipes. There's a roasted garbanzo bean recipe that's presented. People were really receptive to that and felt like it was something that really met them where they were at. And then based on the research that we did, Rescue was also recommending to produce both ads in English, but to make sure that one of them had Spanish language subtitles. What we did find in Colorado was that the vast majority of the Spanish-speaking participants that we worked with reported that they typically consumed social media in English. or in both English and Spanish. And that was true for when they were watching television also, and for when they were listening to music. And so based on that, when we were thinking about how we could really increase reach and impact, we ultimately landed on the recommendation of producing these spots, the flagship spots in English, providing subtitles for one, and then trickling down to having some digital assets and creative extensions in Spanish to make sure we really are leveraging our funds effectively and reaching as many people as possible. So, I mean, that just gives you a quick overview of really more our process than the findings. But I know we have just a couple minutes. I wanted to make sure that you guys had a chance to ask any questions, either for me about the research, or also we have folks from our creative team here, and Kristen and Dina, who can speak more about community engagement pieces.
So, are there questions? I know it's cold. If not questions, are there reactions?
No pressure.
I mean, is this research-based approach something your team typically uses, or is this new?
So I think we're kind of right now in a brainstorming phase with how we're even seeing the project roll out, and so we're really excited that you could come and provide some expertise and direction on what this might even look like for us in Colorado for hunger.
Yeah, that's actually what I was going to ask. How are you taking this information, and how is the department thinking about the rollout plan and timing? And I know this is very specific to the nutrition education piece, but I think for this group, it's an interesting question. How is this an opportunity to then partner some of the enrollment messages and other components that we may be able to layer on this good research?
It's a great point. I would love to actually leverage our work together and see some additional rollout. We've, in our plan, in our campaign plan, I believe it's April that we're rolling out, is that right?
Yep, yes, late April.
And so it's a late April rollout, kind of in tune with what is seasonal, so kind of a summer trend for foods. But we still have some time for us to work out the details and what our campaign for the blueprint might look like, and find ways to collaborate on that. So we're really excited and hopeful that we can begin to make some alignment.
I have a question about, well, first, I love the behavioral research and behavioral economics and the nudging philosophy behind that. And I think we're seeing that across the state and what we're trying to do. In your work in California, how have you been able to leverage your work in SNAP Ed and the information that you're finding there into CalFresh enrollment, which is the equivalent of SNAP enrollment here? So what does that pivot look like in California? Because I believe it's comprehensive there. You're doing both?
Yes. One of the big things that we're doing in California is really trying to connect the dots between SNAP and SNAP Ed. And so we have two separate contracts in California. One is for SNAP Ed specifically. It's the media and advertising campaign. But more importantly, like from a systems standpoint, we've been working with the California Department of Social Services to connect the dots between the program names and the media and education, the media and advertising program, as well as programs that are on the ground. And so we've just gone through a 2-year project where we've been working with them to identify how we can better create a framework where there is CalFresh Food, CalFresh Healthy Living, which ultimately is SNAP Ed, CalFresh Employment and Training, and then CalFresh Disaster Response. And these are 4 areas that are all funded by CalFresh, but previously have actually been under completely different names, different umbrellas, and have provided a really disconnected consumer experience where it's not clear to people in California who are in need that all of these things are there to support them. So we've really taken like a big picture approach to looking at how can we understand all of these services that are being provided to low-income Californians and effectively connect the dots in a way that makes every single dollar that's being spent more powerful, but that also empowers every single partner on the ground to be a part of something bigger than just what's in their local community. We hear every single day that they are often strapped for resources, don't have enough time, and we're working to not only create this branded structure or this branded framework that's going to make things easier so the people they serve recognize what they're doing, but we're also giving them toolkits and resources and materials so that they are standardized across the state. They can still customize pieces of them for their local community, but what it does is all of a sudden provide this infrastructure that has previously not existed for all of these programs to work together completely differently. And so now, if someone's going into a CalFresh office to enroll in CalFresh food, and this is being rolled out as we speak, we're currently in pilot with 4 different counties across the state. They will soon in April see CalFresh Healthy Living advertising on TV. Previously, that was called something different. It was under a different name. And what would happen is everything just, again, was disconnected. And so they're going to start to see, the actual benefits connected to the education, connected to the services that they're receiving, the programs they're seeing on the ground. And we've already seen in these pilot counties, like a light bulb that has gone off in the county offices to say, wow, like this is so much easier to communicate. And I can see the benefit long-term of being able to bring all of these things together. Does that answer your question?
Great, thank you, yes.
I have I'm sorry, go ahead, Austin.
I had a question about your work with the youth. You said you have a youth army, and that's something we haven't really talked about here so much is how to tap into youth as a sort of vehicle for tapping into communities and families. They're such a great voice and often can have great impacts on their communities. What does that look like?
Yes. So we have a formal program that's based on CDC best practices around youth engagement, where we call it evolvement. It's an evolvement model. It's a model that we perfected over a period of 10 years, where we're looking to create opportunities for youth to get involved, but we want to make sure that youth are involved in a way that is structured, measurable, and creates a tangible impact on the programs and policies that they're working on. We have had in Virginia, again, Nevada, New Mexico, Louisiana, an opportunity to go into schools. And a lot of times what happens when you're looking for a youth program, someone will come and say, I'm going to go find some youth, and then I'm going to bring them into a meeting, and then we're going to create a program opportunity, and we're going to see what they accomplish. But the challenge is that if youth aren't connected to something that they are already doing, and you're not taking advantage of existing infrastructure around how youth are participating in local communities and clubs, these things often get derailed and frankly have very little impact very quickly. And so we go into existing schools where we can find student councils, DECA clubs, Future Business Leaders of America, people who are hand raisers, youth that are hand raisers in these communities, in these schools, and we give them an opportunity to apply for a grant. And with that grant, they may get money that is relevant or related to their club that's important to them, but they also get a cause. And so we package, in one case, for example, Great Starts with Breakfast, an opportunity for them to understand why alternative breakfast models are important to increasing nutrition in their schools, increasing student attention, student attendance, and improving grades. We give them all of this information, we train them, we go into the school and we invite a group of partners or a group of youth to actually participate in the training. And then we typically engage those youth in a program where they can, over a period of the school year, participate in local events, school-based events, and get points for their participation. What that does is it incentivizes them to participate, and we often find that these youth voices are the ones that can make the most change, not only in their schools, but in some cases, like the case of Fresh Spot, in their communities and on a broader level, working even with local legislators. We have a youth leadership team that is comprised of some of the most active members, and they tend to incentivize their peers and coach their peers, get them excited about a lot of these events and programs. And we have measures of progress that we use to measure the impact that they're having in a community. So when they do an event, they typically have either a sign-up card, something that shows zip codes, a commitment to a policy, something that's tangible. We take pictures, we look at those, but ultimately those are used to go to the school board, or those are used to go to the local legislator to show them with tangible opportunity that there are people who are interested in whatever policy it is that, you know, we're looking to communicate. And we have found that over a period of time, you know, these youth are just exceptionally, not only engaged, but powerful at accomplishing, you know, really important things within their communities.
That's exciting to hear. Along those lines, when you were doing the messaging research, you talked about, and this is my first meeting, so I apologize if covered earlier. You talked a lot about families, but those images were very adult-centric. Did youth inform the creation of that at all? Like what your picture was just the mom to the parents, and you said family, but it was only adults.
The spots actually, I know you just saw a still shot, you didn't see the video, but actually families were heavily involved in the spots. So in the first spot, it's about a mom and a dad and 2 children, and they are all creating the snacks together. And then in the next spot, there's actually something that the participants really liked was the dad is actually leading the cooking of a cauliflower rice with his child, and the child is playing that active role, and there's that back and forth between. So yeah, we did find that family was a very important focus among the Colorado audience, and we were able to actually use that in the spot.
Further answer your question too, the campaign is really designed for adults, so it's not a marketing campaign for it. It's a family campaign, but meant to change the adult behavior, but not for them. So we didn't do focus groups with children to inform the campaign, if that makes sense.
I'm not thinking too much little kids, et cetera.
Yeah.
The reality of it is you want that message to stick. Involving kids and parents. Is one of the way they see it.
Absolutely, and we do that with our method education practices, but for the scope of the campaign itself and what it's meant to impact, we should a little bit more narrow.
Are there other questions? Anyone else? Yes.
This is my first meeting as well, so excuse that. When we talk about a specific geared toward a SNAP-ed population, as it's been phrased in this, is there ever a conversation that what's good for the SNAP-ed population is great, it's good for everyone? You know, like we could all improve how we eat in our daily lives and our healthy eating practices. Is there ever a conversation about expanding beyond a specific population, so you see it reinforced not just in certain venues, certain places, right, but outside of that?
Yeah, so I think your question is, you know, are we able to think more broadly than just the SNAP-ed population in the way that we develop creative? Is that correct?
Yeah, and just that I think there's the holisticness sometimes in the reinforcement, right, and that when you see a message repeated in multiple areas, even though the primary beneficiary, or the greatest perhaps beneficiary would be the SNAP-ed population, it just would be nice to have it reinforced in broader context.
I think the short answer would be yes. I mean, we are excited about the opportunity for there to be a halo effect. But the more specific answer is that we find that the SNAP-ed population in particular is a population that is not getting very specific health information in a way that they can incorporate these healthy behaviors into their life. So if we think about what we've learned through focus groups, through some of our ethnographic interviews, and through really learning what the lifestyle and the daily habits are of the SNAP-ed population, you know, these are people who are working multiple jobs. They may or may not have reliable health care. They may or may not live in an environment where they can safely go outside. And so when we tell them to eat healthy, the challenge is that these are not, they probably already know that, frankly, but we're not telling them in a way that's easy for them to incorporate it into their own life, given the barriers and challenges that they experience every day. And so what we try to do really deliberately is to understand, you know, how they walk through their daily life, and then integrate healthy messaging, whether it be drink more water, whether it be, you know, eat more vegetables, or whether it be, you know, do more physical activity in a way that is easy for them to incorporate, and it doesn't put additional barriers in front of them. We have to make sure that food choices are not too expensive, that physical activity opportunities don't just look like aspirational Fitbit commercials, And that, you know, the way we think about incorporating healthy vegetables thinks about things like their culture and their heritage, and them being able to still provide for their family in that cultural way. Or it's a stable and reliable meal that I know that my kids will eat, because if I make something that my kids won't eat, then that's wasted food and wasted money. And so there's some very specific elements to the SNAP Ed population that we frankly think that are often overlooked and cause this community in particular to not really believe or see that any other health messaging is relevant to them. So when we focus on them, also with commercials and information that has a higher production value, that is aspirational in a way that is accessible to them, that generally gets a very, very different reaction than some of the more healthy, you know, encouragement that they might see through grocery store advertising or through a new, you know, branded fruit product or something to that effect. Does that make sense?
Well, I actually agree with Shannon's point, you know, as well, and I think that within the scope of the design of this initial campaign, it was all used as SNAP Ed dollars, and so that was who funded the design, the research, all of it. So in the case of that, you have to target specific audiences, and I would love to leverage this work. I would love to expand the work, and I agree with you that the scope of it could be broader. And so I think that's where partnerships and leveraging our resources can really come in.
I want to come back to, you were going to respond as well, Jennifer, and then I want to bring this piece to a close. We have another presentation, and we'll have an opportunity for discussion about this again later. But Jennifer, can you?
Yeah, I just wanted to say, so I think one of the beauties of the blueprint is that we want to see a holistic approach to raising awareness of hunger and the positive impact of access to affordable and nutritious food around the state. And I think the rescue agency or entities like that could leverage what's happening in Colorado. We don't have even a SNAP and WIC outreach campaign, and we have 320,000 people who are eligible but not enrolled in SNAP and 100,000 in WIC. And I think the beauty of a group like this is to elevate that as a priority. It's in the blueprint as a priority. So what might that campaign look like? How might we leverage what we have? How might we find funding to do something like that? I think is what we can as a work group work on as next steps.
Excellent, thank you. I just want to ask a clarifying question about your research before you close out. As I was looking at your ethnographics on a couple of your slides, and you said you interviewed 51 individuals in the state. I am wondering if the individuals that you interviewed reflect the ethnographics of those who are registered in the SNAP program. So were they representative? They're representative of Colorado's ethnic demographics, but I'm wondering if they're representative of the SNAP demographic as well.
Yes, I don't know if you noticed, but on the slides, I believe it was between 70 and 80% in both formative and in our BCC testing actually were enrolled in SNAP. And so we were able to kind of make sure we're getting that population as well. And the entire sample, we did aim to reflect both the SNAP Ed and then the SNAP eligible population.
Excellent. Thank you very much. Thank you for joining us. Any last comments? We appreciate our master technology, our technology IT guru in the room, Kevin. Anything else that you all would like to offer in closing out this part of our day?
I think the only last thing we'd share is we really appreciate the opportunity to meet all of you. And one of the things, as Shiloh kind of alluded to, is that we feel strongly that if there are learnings that we can share from across states that help inform, better education, nutrition, intervention programs, that, we're open to sharing as much as we possibly can. So if you have other questions about things that we didn't cover today or the things that I brought up really briefly at the front of the call, please feel free to reach out. We'd be happy to share more.
Thank you.
Thank you very much.
Thank you.
Thank you.
Okay, we're going to take a segue. We have a second presentation. There are, people who have joined us in the room, so I'd like to take a minute and go around and let people identify themselves who have joined us, starting first on the phone. Shayla Richard, do you want to, just identify yourself? And the very quick thing we did was to say what we hate about the cold. And you're on mute, in case you didn't know. Okay, Shayla, we'll come back to you in a little bit when we can hear you going around the room. Other people who have come in since we started, Michael, we'll start with you.
I'm, Mike Buchan, I'm the executive director of Denver Gardens. Cool. I actually like the cold.
You have to come up with one thing you hate.
Hate the grainy snow when it gets so cold it doesn't, melt. Yeah, like sand.
Okay.
Actually, one thing I don't
I think we're coming right down this line. We have a couple of others yet.
Yes, Juana Henderson from Beyond the Classroom, and I definitely do not like shoveling snow.
Thank you.
Christina Bejarano, independent public health consultant, and what I don't like, not only shoveling, but when it's humid and it's ice, lighting.
Okay, yes, ma'am.
So my name's Shannon Sporlock. I work with Denver Urban Gardens, and let's see here. I would say actually I really love snow, but it's the icy piece I don't like. But I love snow.
Okay.
Lacey Benson, sorry I was late, I was at the truck this morning with a few other people. And I work with Khadijah, and I don't like the fact that I can't wear my cute shoes.
Very, very
You
practical.
can, it's just cold. I did Thursday.
Oh, Deidre Johnson, I'm with the Center for African American Health, and I have to echo the ice theme, walking and driving on ice.
About cold.
Yes.
Okay. Did I get everyone who came in and joined the room since last time? Great, thank you very much. I think we are ready. Michelle, you're gonna do the introduction for the next, or are you? Okay.
Go ahead, please.
Okay,
I was just trying to
perfect.
frame out the whole conversation.
Okay, thank you very much. So this is a good time to shift a little bit because we have, or did you want to be in the front of the room for your presentation, or are you okay where you're seated? You can, okay. So just as a reminder that coffee and beverages are in that part of the room, and the restrooms are just right across the lobby area. Do you want to make an introduction, or are we good to go?
Yeah, sure. No,
Thank you.
thank you for joining us today and hopefully in the future. I have been really excited about this platform and working with Eric and Deidre for quite some time. They're actually a subcontractor as part of one of the first grants to support the blueprint. And I think that when we see the work that's available, I think other folks are really going to want to join in the platform that they've developed to get deep and meaningful community engagement and information from the community. It's one of the most promising practices nationally, and we're just really lucky to have their leadership here. And again, thank you for joining us.
I didn't think Jennifer before me. Thank you for having us. We're excited about this work. Before my colleague Eric gets started, just a little backstory. And I've been in this sector for about 20 years. And one of the things, whether it was being a nonprofit, philanthropy, et cetera, that bugged me was when I asked about data around diverse populations, it was always, sample size is too small, we're doing our best, and no one's responding. And then when I met with my predecessor at the center, Grant Jones shared with me that in 2011 we had done a survey, old school hard paper survey, 2,000 respondents. So what that told me was it really is who's asking the question. And with actually the help of the Health Foundation, we got a special project grant and looked around for survey methodologies, realized that the old school way of doing it on paper film was really kind of dying out, and discovered paneling. And we had a great conversation with We Heard Philly, which is located at Temple University, and with their assistance, started our own We Heard panel. in 2016. Kind of neat because we heard popping up, we're the only panel in the nation that's not housed at a university, even though we keep them close friends. And I'll let my colleague Eric, who runs the panel, take it off. But really what it's done for us is not only giving us a way to communicate with the community and get information back, but the infrastructure is helping us work with other partners throughout the state, and our goal is to keep growing it. So we can not only share with folks what's going on, but really find out and uplift community voice as we go along.
Yes, my name is Eric Moore. I'm the Research and Evaluation Coordinator at the Center for African American Health. I also run Be Heard Mile High, the panel. As Deidre stated already, that it's modeled off of Be Heard Philly, coming out of Temple University. They are really good partners for us in helping us understand the methodology behind running the panel on a community basis. With Be Heard Mile High, what we do is we engage the community we engage community members out in the community events mainly, but we try to research, we try to look into some different social determinants of health that will kind of give us a little bit more about the social conditions in which Denver residents are living. And primarily we are focused on looking into the African American residents here, but this is something that can be very good to use to explore other underrepresented communities. Overall goal is to raise awareness on different health and social justice issues that communities are experiencing here, and to engage and communicate with them as far as the different resources and educational materials that are available to them. And with that, we have organizational partners that we work with on some different levels. We'll get into that. We have a community advisory board and a faith and health advisory council. But with them, we help to use their networks to help expand information, and then also to help with advocating for different policy changes and programming on the community level. And currently, the requirements we just have is that you just have to live in Colorado and to be 18 or older. And with this, would be heard, as Deidre noted already, that there is a kind of a gap when it comes to the data that represents the African American community, and something that also can be experienced by other communities as well, just because of maybe traditional research methods have not tapped into those areas. So with this, we are able to use this to kind of get more trustworthy data coming from an institution also that has done over close to 20 years of work now with the community as well. It's been a good way of being able to show that we are committed to actually understanding what's impacting the community and engaging them and having them feel involved and taking ownership as well in the process. And with that, some of the issues when it comes to social determinants of health, we mainly talk about a very variety of things. So the things that affect the way we live, work, eat, play, and pray. So we do housing, transportation, we look at eating habits, and we look at things that are a little bit more connected directly to health, how you feel on physical, mental health, oral health. With that, we try to make sure that we can be able to use the data in meaningful ways, that we can collaborate with community partners, and be able to have opportunities to engage the community in discussions and to present the data as well with them. With Be Heard Mile High, it's mainly a survey methodology. We use questionnaires, so we do send out micro surveys. These are ones that we're trying to basically do less than 5 minutes or so take. But with these, we try to get very impactful questions about what they're experiencing, what the barriers are, and to give opportunities to feedback. We have had some opportunities to do some focus groups as well. For example, last year in July at our Destination Health, it's our 5K run, 1 mile walk. We set up 2 focus groups on different things such as racism in education and also healthcare experiences. We've had some good opportunities we're trying to actually increase our opportunities to be able to get more communities, be in the community setting and have these discussions, but primarily we do surveys to be able to collect and ask these questions. Through community and through the panel surveys as well, we like to promote inclusiveness. This is something that's been kept in mind for the African American community in particular. But it is something, again, that can represent other communities as well. So it is something that is open to different demographics, people coming from different demographics and neighborhoods, and create some different opportunities for them to tell us what they would like from their communities as well, so we can see if maybe our partners could actually help with assisting them in their endeavors. Again, some key parts of what Be Here Mile High has, we have a community advisory board, faith and health advisory board, a council, and then we'll talk a little bit more about some of the dissemination of the surveys we've done, and also some of the recruiting and incentive strategies that we have. So the community advisory board, with these are a variety of different people coming from different multi-sector organizations. With this, they help with a variety of things. So they help with us just being able to pretty much understand how to engage communities that they engage with, some of the things that's worked for them as far as the methodology, their approaches, and also just tapping into more of being able to use the data going forward to help with policy and advocacy use. And with that, because we have so many different organizations that are tied with us, we have a vast network that we can disseminate this information with, and to be able to see what exactly is something that in their area maybe they could help inform where we can do better. With this is a benefit that a lot of people who are in their industry can help us with more of our specific surveys. With our Faith and Health Advisory Council. With the Center for African American Health, we've for a very long time had relationships with different faith groups and community organizations here in the Denver metro area. And that's something that we've been tapping into. So last year, we've had a lot more contact with different faith groups and reaching out to pastors and first ladies, the congregation members, their health liaisons as well, and seeing what it is that they would like us to do as far as how Be Heard could help them, or maybe the methodology as well. On top of how we engage the community, the faith community, we will go to events at churches, present about Be Heard, some different resources that our organizational partners have available as well. And we try to make sure that church leadership knows that even if Be Heard something that's not interested in them, it's something that we can still use to help with collecting data about the congregation members. So we help with even creating surveys on things that they would like to know about the needs of their congregation members, some barriers that they have, and what they would like to do, and using that to help create more of a cohesive community within that. And just an overview of some of the demographics for who's on the panel now. We have a little over 1,100 people on the panel. The project started back on May 17th. May 2017. A little different. And just to kind of give you just a little bit of rundown, with the neighborhoods on the left here, we have a majority of neighbors coming, panel members coming from Aurora and Park Hill. We are in the Northeast Park Hill area ourselves, in Clayton, near the Clayton campus. This is mainly where we do a lot of our activities as well, in the Five Points, Whittier, Skyline areas. So we do have a heavy representation there. This gives us an opportunity to look at neighborhoods where people have self-identified as being where they reside or they spend most of their time being in. And this gives us opportunities to reach out and engage the communities that are underrepresented in this demographic. Also, as far as age, we have a median and mean age are around 42. So we do have a little bit of an opportunity there to engage more of the youth involved, people 35 and under, I would say. With our range is pretty wide. We have 18 to 99. We have a variety of people who approach us at these events and are interested. So it's a great opportunity for us to look at some areas that we could expand into. As far as gender, relatively, with all our questions on demographics, we'd like to emphasize being self-identified. We would like people to know that they can give us exactly what they would like to know about themselves. So we try our best to make sure that we keep it as inclusive as possible. And with that, we do have more of a heavy representation on female participants. That's mainly because of the incentives package that we started off with, gearing more towards items that would help test it better with female populations. And that's an opportunity that we're looking into now, and increasing more male recruitment and involvement in our panel. Some more numbers. Zip code we have here on the left side. As far as we know, as we know, zip code can have a huge impact on our health. So that's another important demographic we wanted to collect as well. Again, like neighborhood, it gives us an opportunity to see where we could expand into, and particularly which neighborhoods within zip codes are not being represented here. Another question we happen to ask a lot about is some things that kind of give us an idea of like family life. So we ask about whether you're a parent, caregiver, or guardian of any children, anybody under 18 years old. Although we don't recruit anybody 18 and younger into the panel, this gives us the ability to separate this cohort out and be able to ask them specific family or child-related questions. And then also we have the self-identified race and ethnicity. Again, most of our events are centered around areas where African American residents will be around. So we do have a higher number of recruitment in that, with white and Hispanic population and Latinx population being a close second. Again, this is something that we could use to expand the program even to a state level where more communities can be involved and we can be able to give neighborhood level specificity to what's available out there. As far as survey dissemination, so the micro surveys, we have 3 different ways you can receive them. You can get them by email, text message, or mail copies. The highest, and I apologize, I didn't have any stats, but I didn't pull up any stats for this one, but majority are people who are receiving it by email. With this, these surveys come out every month. So we send these out every month to panelists. More of the recent topics we have for this month is maternal health. We have a health fair next month. We have an annual collaborative health fair on March 9th on the Saturday, and we are actually going to be focusing on maternal health issues as well. So this survey actually offers an opportunity for us to ask some questions to help inform that event as well. But some of the more recent things, you can kind of see the wide range. We have things like transportation, involuntary displacement, including specifically gentrification, and also with eating habits. Eating habits in particular was something we were looking at with how exactly people engage their eating, how people go about, I would say, how do people go about deciding how they see food, the relationship. So we looked at things as far as, who you ate with, where you went, how close to bedtime, all those things, and kind of going more outside of just the basic fruits and vegetables services. We also had a few different surveys. There's one that I'll talk about a little bit later. We have one that asked community members about how they felt about RTD passes as far as having more affordable rates. And that's something that we found very interesting as far as how they identified youth and low-income families and how they should be able to have more access to local transportation. And we had some surveys that also helped us inform our process. So strategic planning survey helped us to prioritize a few of these topics for us to survey. And we had one about learning about our community health, which informed one called Your Community, where we asked more about the cohesiveness and safety that people felt in the communities that they resided in. So there's opportunities to be able to get more information on how to best engage community members on what interests them in relevant topics and timely also to what's happening in Colorado.
These are all real time, so we don't have to wait. It's however long we want to leave it out there. Some of the recruitment we do, we always have a street team that is active during the during the spring into the summer. A lot of the community events we do are ones around cultural identity. In particular, we have things like Juneteenth Music Festival and Black Arts Festival. Great opportunity to meet other partners who are doing things in the community as well, to network and to get a wide variety of individuals and families who attend these events. They've been very useful, and we've been trying to see how we can expand them more out. Primarily, we've been doing things in East Denver, but also in the Montbello, Green Valley Ranch area. One event we did that had to do with our faith-based activity is we held at a small church, they had a Health Sunday event where they brought their congregation members together, and we came in, told about the Beaver Center as far as some of our programs, and then also enrolled people into the program, and just connect them to some resources. We also had inner city health clinic come by, and they coupled with us to help provide health screenings and immunizations, which is something that the faith leadership of that church wanted to had set up previously to make sure that this was something that was beneficial to the congregation. As far as incentives, we do try to make sure that they're ones that the community can identify with. So we do look for local businesses, for particular like we have Coffee at the Point in the Whittier neighborhood.
and we try to make sure that we are ordering from so we are using vendors, local vendors, but also ones that are particularly aligned with the African American community as far as the products and identity that comes with those. And with that, we are looking at exploring more mutually beneficial partnerships with different organizations that are operating here so that we can get more people aware of the project and also aware of the businesses that are operating in the spaces as well. Some of the, usually at events, we have big ticket raffle items that we do to encourage enrollment and to kind of get people talking more about what we're doing. So some things we've done is just mostly just raffling for tickets to concerts, book signing events, things like that. And we're happy to do a lot more things around family passes for the Denver Zoo, for example, or the Denver Art Museum. This is one survey that was, just wanted to bring up some statistics on it. So this is something that we wanted to gauge and look and see how people felt about RTD's rates as far as being able to afford passes. And with this, we saw that a lot of people reported that youth and lower income individuals and families would particularly benefit from this, and in how they get to their shopping, how they get to activities that are around school and work, and how do they get to their health care. And with this, we found the theme that a lot of people wanted to make sure that they can understand, but they could have things that would eventually give them the stability to be able to have these things not being interrupted throughout their daily lives. On the right, we just have some demographics about who answered the survey, and again, it's pretty spread out as far as who we polled for this. But it's a good opportunity for us to be able to do more of these kind of engagements with the community, to ask them more about how they feel about these issues and what they would like to see city and government officials do about it.
This actually bubbled up because at the time, RTD had a work group that was looking at the question of should there be reduced fares, and so we were able to go to that work group meeting and say, yes, there should. Here's the additional information.
So it was a good opportunity for us to be able to connect with the community on something that was already kind of bubbling out in the public space. And also something that we did last year in June, we had an opportunity to engage communities. We invited all the panel members to come out to look at to understand the project, to look at some of the data we've collected. We had information that we displayed to them through a data walk. So we had some posters blown up for them to come in and view the data, primarily around physical health, mental health, racism in media, and housing. And with this, it was a good opportunity to be able to display the data and have people give them a chance to be able to talk more about how they feel about how representative the data was, any questions they have about what they would like to see develop forward. And it was a good opportunity just to kind of tie it into very family-centered activities. So it was very, I would say it was a very good time, and we're looking forward to being able to do more of these kind of celebrations so that community can come out and visit. Some changes we have to the Be Here Mile High platform. So we are making efforts to increase our ability to handle creating data that's rapid, that can help contextualize the stories that are around them and be able to share them with our organizational partners. So with this, we are looking at, and one thing we're doing for our street team is we will have a data analyst. We have a data analyst team that will help with pushing more of this out. But we wanted to be able to make sure that we can have data products that can be publicly shared in particular and given out to the community so that it would be a much easier way to go about sharing this information with the community we're collecting it from. Another thing is we're actually looking into, we're in the process of getting a panel management software that's going to help us with a few different things, help us be able to create some login profiles for panel members, which may not be necessary, but as much as far as it might not be something that is fully utilized, but we are creating processes around that to make sure that people can still be able to see what kind of services are available, what they can take, some prizes and incentives that are available as well. And primarily, something we're interested in is the clients and researchers that we work with, which in the next slide we'll talk more about some other different partners that we're working with. But with this, we can use these platforms. We can use this platform to be able to allow clients that we're working with to be able to view data, look at a lifetime monitoring of it, and to be able to submit feedback to us in a way that's a little bit more, I would say, streamlined for their convenience as well. So we want to make sure that we make it as easy as possible for people that we are working with to help collect data that's important to them and their communities. And another thing is the software in particular is very good at being able to split down cohorts by different demographics, and that gives us some opportunities to send very specific surveys to certain groups, particularly people with children, people in certain neighborhoods as well that might be experiencing maybe higher rates of issues than others. And some of the client work that we have in collaboration we do up in Larimer County, we are working with the Family Center La Familia. They work primarily with the low-income Latino population there on different resource relocations, resource management, but also on community life aspects. So what we do is we help with disseminating their surveys, their bilingual surveys, and analyzing the statistics on timeline that works best for them in their communities. Another thing that I'm involved with, I'm also on the Eastside Unified Council. So with Eastside Unified, they're dedicated to making sure that they create communities in the 5 neighborhoods of East Denver to help create more of a cohesive community, and also to make sure that households are safe and stable for families and children. And that is another opportunity that we have now. We're working with them to be able to collect some baseline data for some data indicators they're looking at, and mostly around things like socializing and being able to use certain resources that are available in the county for them, in their communities. Another thing we're just starting now is we're talking with community liaison who's working with the Research Institute that's connected to the CU school system to try to find more information about the health needs and issues of youth, and to be able to use their research team to be able to translate some solutions for the at the neighborhood level. And it's a great way because I feel that there's not really a lot of data, and when it comes to being able to assess youth priorities here in East Denver, and this would be a good way to engage them in a way that's meaningful and to give them some, I would say give them some benefits and some tangibles that they can leave with, and particularly removing the things that have to do with being able to be self-sufficient and being resilient to a lot of external factors that we see here, primarily when it comes to minority communities. And that's all. If you guys have any questions.
A couple things I would add. So the real interesting thing about it is we started this work because when it just raised community work. It's going very well. It's also put us in that research space. So we're going to be in Toronto in May presenting to American Association of Public Community Research along with Temple about the work and how it's going. Our work with regard to the blueprint is really focused around the development of the toolkit. And when we last chatted with Lauren before she transitioned, it was really to be determined whether we wanted to talk to folks in counties about how it's going and what they need versus the participants. So either way, it's pretty flexible. And the other thing I would share is we're also talking to other groups, because eventually we imagine we have the infrastructure. Just like Larimer County, we're doing surveys for their modeling Spanish residents, talking to Servicios and others about what do we have like through their website. And so we're constantly growing and looking at ways to really uplift those voices that we don't hear from very often.
Thank you very much. Appreciate your presentation. So I'd like to open the floor to questions, comments, and reactions. Yes.
Just curious how you decide on the priorities for your surveys and your you may have touched on this a little bit, but I'm just interested to hear a little bit more about how you choose what to look at in terms of surveys.
It's interesting how start off. When we first started, our very first summer, we had an intern who did. We wanted to focus more on the social determinants of health. And so she came in and created 30 different surveys. And so we wanted to make sure we had a variety and really hit each of those determinants. Going forward, sometimes it's a request, and then sometimes we have it built in the surveys where we'll have some available topics that might be of interest and allow them to be able to select ones that we have down the pipeline, but also to give us feedback on any ones that they would like to see us be interested in. And using that, we can kind of categorize a survey that might be able to condense a few different things. So if people ask about, nutrition or about food, healthy food, being able to reach out to food, or eating habits, one was one that we got to ask a little bit more about how people can reach these kind of things.
I think what's really interesting, maybe you can talk just a little bit more, about, you do have this ability to tap into local partners who have email lists and clients that they, constituents they may want to survey on behalf of the Blueprint around barriers to access, barriers to benefits, perception, and just kind of talk a little bit more about those partnerships and how that might work.
Oh, definitely. So for instance, one that's not up here, last summer we worked with Scholars and Women, to do some parent education, and we didn't want to just show up with a class. So we did kind of an interest survey, which they in turn sent out to the parents at all the schools. So ultimately, the real issue is who has the contact information and who's most likely to get responded to. And so from schools, definitely parents are going to respond to their kid's school as opposed to the nonprofit that's sending something. And same thing as I'm talking to Servicio. Not only what's most important for them, but for them to send it out is more meaningful to their constituents than us randomly sending something. So we always make sure who's the best messenger for these questions. But at the end of the day, it's our infrastructure. So we've got the Jaguar software that's supporting them, and talented individuals.
I think you guys have amazing information. I'm curious, it sounds like you're very targeted with who your audiences are. What do you do with the information after? Like the RTD example, I think was a good one, but is your role really to collect the data, or do you guys then go out and utilize it in some way? I'm just curious of your role.
So it's interesting. When we first started this, we figured that the first year would just be outreach. And that started happening so quickly that now we're really looking at how can we really be that advocate. And so talking to other health advocacy partners, opportunities like the RTD Workgroup bubbled up, when this opportunity bubbled up to be involved in the SNAP education system. So we're exploring ways on how we can do more sharing back and also advocacy as we continue to kind of build it up. One of the things we're interested in is so we've been going to those events where people are used to going, but that doesn't mean our panel is as demographically representative as I'd like it to be. Because we really want to get to more of those folks who probably don't have time to go for our festival. And so that's why we're doing more church outreach, talking to Children's Hospital about, they're doing some work around the corridor along Colfax and asthma research. How can we reach some of those families, really have a broader net. But, plug and play. If something interesting comes along, because it's real time, we can kind of pursue it.
I just want to say that I've received these surveys in my inbox, and I've taken them, and I've received them on several different topics. So they have my one voice on several different topics, which I think is really cool. And what I wanted to ask you is, how do you monitor that one, if you have one person and their feedback on different areas? How do you break that out? Or do you take a look at, do you have some sort of data analysis on this one person said, responded this way to these different topics?
Oh, as far as like tracking that one respondent? Oh, I see. Yeah, I mean, with the panel management software, we have it where it can track people who, completed the survey, who opened, didn't complete the feedback that they provided. A lot of the data that we share is aggregated, so we do look at the broader picture. But the individuals are ones that we can section out and be able to contact them. So if we have a variety of individuals who are expressing a certain concern of something, that's something that we can set out now. It is something we're starting to do now, so we are focusing mainly on a large group. But we do have the ability to track individuals and be able to create the separate cohorts just for them to be able to help them engage them more if there is something that they're indicating they would like to see from us, or if there's certain responses that we need to follow up on. But mainly we do look at a bigger group as far as what the communities are saying, and usually by their zip code or their neighborhood.
I think with our new module, you'll be able to sign on and kind of choose surveys and look at what other people are answering. So it's going to be a lot more dynamic.
In that process, are people self-identifying ethnicity, and is there a verification point on it?
Self-identifying.
So you couldn't, never mind, that answered it. Thank you. Yes.
I wanted to ask the question, earlier on in the presentation, you talked about that your participants are 18 and over. But then you mentioned this, the youth survey project towards the end. Are they also, I mean, is there a stipulation that it has to be 18 and over, or do you have a way to actually survey adolescents? Yeah,
Well, I mean, the project is set up just for 18 over now, but we can still use methodology for youth. It's just not something that we explored initially with this project.
Okay. Well, there is a possibility.
Yes.
Oh, definitely. I mean, if anything, it's wanting to be on the safe side starting out, adults. And then, certain things we do might require an IRB, so just be very cautious and careful. But, if you can answer, at this stage, probably do it in kindergarten, if you can answer a question on email or text, you can participate.
So the youth needs survey project, is that, are the people answering it adults or youth under 18?
The goal would be youth, but that's still being worked out.
Got it. Okay, cool.
That we're excited that it's in the pipeline.
Yeah, so, okay, more pipeline right now.
Other questions, responses?
I have a couple quick questions. So one, you mentioned kind of your total participants, so when you are sending out these monthly surveys, is that going to 1,000 people, or like, how many are actually receiving it?
So right now, yes, with these broad topics, everybody receives it on the panel.
Okay. And then is there an incentive each time that survey is done?
Yes, every time they enroll, they get a chance to, every time they complete a survey, at the end, they get a chance to tell us what incentive they would like to be chosen to win. And we do a drawing every month to give a few incentives out to different panel members.
Okay.
That's one of the things we're looking at. So for instance, the health department has a similar count of moms. They only have 100 people. It's easy for them to say, oh, we'll give you $20.
Right.
Or we can't do that. But, we're excited to see this new interface, it's more interactive, what effect that will have, as well as some of the incentives. Like when we were at the church, the small $5 gift card, and that one, we got actually the majority of the folks that were doing that. But it really does kind of vary. But there's always something. And even at some of the summer events, man, great tickets.
It's like, can I win?
I know.
Anything else from the group? Parting comments from the center? Anything?
Oh, really excited that this work is happening. When I first went to the kind of the rollout for the blueprint, it was nice to see the way it was laid out and the different tracks. We're looking forward to getting started on the surveys once we determine the best way to help with the toolkit piece. This is important work that's overdue, but when you think about things that are solvable, those are the exciting things.
Excellent. Thank you. Thank you so much for coming and presenting. I don't know if our others are still on the phone. No, everyone's left on the phone. We're very close to closing out our meeting. We have about 20 minutes, but we've been really attentive and focused for almost an hour and 45 minutes. Thought people might want to take, you got 4 minutes because we have some really important things to, in the last 15 minutes here. So if you want to take a little 4-minute break and stand up and stretch yourself and hug people that you haven't been able to hug so far yet, hug them hello and. We made it.
Thanks, Eric. That was really well. Appreciate it. I'm gonna check the FPP now.
Yes, sir.
I'm sorry.
Yeah, that's what I said, it's 15 minutes.
Okay.
We got, that's
Maddie's
exactly.
here. She's ready to talk about her.
Excellent.
So, yeah.
Thank you for the reminder, I appreciate it, that's forefront,
Yeah, no worries.
my little star on my.
Yeah, mine too. We'll have to think of a way. Can you be able to like break these tables out next time to get a
we talked about,
yeah.
take a few minutes at the end to do it. I know some people have to take off, but, I think that needs to be compensated, because we are now picky, very
Yeah.
well, it's also,
And,
but,
and, yeah, we'll, all, track, like, how much turnout will be. I think quite a few of them will be in that room. We do have some other rooms the rest of the year. And the one.
sorry, some of the newcomers who are in the room, capture their email address and put them on the invitation.
Yeah.
Calendar invitation and other stuff. I'd like Mike for sure, he's gonna be.
Yeah, so Shannon and I are gonna tag team.
Okay.
After lunch.
Okay, good for you.
She's gonna hang.
Okay, good, thank you so much for coming.
I was late, we were over at the.
Yeah,
Crest.
yeah.
But, yeah, whatever.
Okay, thanks.
Okay, thank you. She can provide my email and all that.
Yeah, we'll have that.
Yeah, okay. And
I will ask her to keep.
Yeah. Yeah. Oh, yeah, yeah.
So some of my team did the design, I don't know if we've gotten, I don't know if we've gotten a level of count of content and social, like 5 or 6 guys, that would be really helpful for me to have.
Yeah, no,
Here's why we are, oh, we don't do 1 page or 5 pages.
They have to be very.
Yeah.
That's what I was.
Yeah.
So I don't wanna. There are a couple of things I feel like I have to say. One, everybody. I'm getting ready, and I'm really asking to, I'm asking if I've got my stat mouth.
See a cancellation like on Monday.
Oh, yeah.
Calendar, so it's not.
I'm also having
And also, it started going into my computer, because there were so many.
It's like a. Yeah. In my mind, there's two.
Ways to identify this.
Yeah, personal email. Yeah. But, on that.
But it is. Right, and so, yeah, so, but you can.
Yeah.
You can,
With me.
hi, how are you?
Web and craft. That was our question about some of the, I mean, all of our users, a lot, they need to be an already utilized. I don't know if it should be.
They also, like, if I know that. Like exponentially. So,
yeah. Simple rack.
Oh my God, that works.
Oh, good, I'm gonna die from an
Yeah, now there's but on Zoom, I can say.
I just wanted to.
Yeah. You know, all that happy is that is, and it is a big. And I can see, I made a change, we did it, I just did it. And it went out to the whole governing council, and then it was flying out the, it kept setting up contracts.
Yeah, I think our 4 minutes is
My
up.
personal email, and I crazy.
Oh my gosh, Carl, my coworker.
Yeah.
Come back to the beach.
Like, yeah, thank you, sorry. I'm sorry. Okay, sorry. I started.
Okay,
forward with
Okay, thank
with
you.
the ending part of the agenda. If everybody can take a seat, that would be great.
Thank you.
So one of the things, that I just wanted to, before we go through the agenda, I think both of these presentations were really great to level set what's happening already with the blueprint, some things that are funded through the state, as some ideas that we might leverage as a group, to put forward some recommendations. So if we wanted to, do a comprehensive, marketing campaign that linked SNAP Health, or SNAP Ed and the Healthy Context with, health and nutrition benefits of SNAP and WIC, and as opposed to not even having a campaign around SNAP and WIC. This is something that this group could bring forward. And I think with the Be Heard, Mile High, the one thing Deidre didn't say is I said, please grab Be Heard Colorado as a platform. So that if anyone in this network really wanted to utilize this deep community engagement, it's been invented and we can leverage those. So I just wanted to kind of talk about those pieces and how we think through this, how this group might leverage and get some quick wins. We now have a little bit more information to have those conversations about what next steps could look like. This is only part of the information, but to know also that people have been working on stigma and the information on barriers, because that's come up in a few of our meetings. So we've got some really good traction with these. They also can bring in information that they've already found out, so that we can really kind of dive in on some of the priorities that have been set. So I just wanted to kind of wrap all that up so we knew why we just got a lot of information all at once. And then I'm going to let the rest of the folks tie the rest of it on.
We do own, Be Heard Colorado.
I know, that's why I'm so excited. Yeah, no, it is locked and loaded for expansion.
Excellent. Thank you so much, Jennifer, for that. I wanted to just encourage you all to fill out your evaluation forms, because we are looking to be responsive to the request of the group, and that is to provide you with some more information and to have a sense of what's happening around the state. And that is also why you have been receiving a lot of information, and that will be true for all of the work groups, at least for this month. So if you have other information that you are looking for, that's Jennifer's wheelhouse. She can get you anything you want. She's like a walking Google kind of thing, except you just don't press her.
Don't press on me. I prefer email hug, but that's about it. Okay.
So one of the very important things that we need to do is to come back and close the loop on the leadership for this work group. We have asked for folks to self-nominate or to nominate someone to come in and be group leadership. We had a response, and we are we're very happy that we have someone in nomination, and I want to give you an opportunity to talk a little bit about why you'd like to lead this group.
So, I'm Maddie Philly, I work at the American Heart Association, and I, on an individual level, and then as a representative of AHA, would love to be a chair, or if anyone else is interested in co-chairing, love to partner. On an individual level, I've had a lot of experience facilitating groups. In my prior life at Children's, I was the wellness administrator, and so we had like about 80 different wellness champions from all different departments. So had that experience for a few different years of trying to make sure to meet different people's needs and ensure their voices are heard. At the American Heart Association, I lead the Corporate Health Committee, which is volunteers from throughout the community, working more on event and promotion of well-being resources. And then in my current life, really supporting some coalition and community building in terms of healthy kids meals, beverage work. So I have a lot of different facilitation and coordination experience. This is one of my huge passions, and really excited that my work has shifted more from the workplace space to the community, though I love both. From an organizational space, we have a lot of resources and experience on a national level with Voices for Healthy Kids, as well as as our work has moved into the community, we're really, this is a huge passion, and I think this is a huge opportunity. So I would love to hold this position, but like I said, if anyone else is interested, would love to co-chair as well. And I think the other great thing is, in my role, I have a lot of capacity and flexibility for this, so, yeah. All I wanted to say.
Thank you so much. Thank you for stepping forward. Thank you for sharing those comments with us. Is there anybody who just wants to just join in to yoke up on that great team? Okay, so
Don't all come forward at once, guys.
So we did pass out a sheet of paper 3 or 4 times that talked about the process for doing this, and it did say that we will vote. I think a vote is just unnecessary, but just because it sounds nice, I would like to suggest that this group accept Maddie as the chair by acclamation, and that acclamation would be signified by applause at this point. Thank you very much. We will be supporting her. The Trailhead team will be supporting her in this role, and we know that you all can communicate with all of us who are on the team and communicate directly with Maddie if there is something more that you would like to share. We are wrapping up in 6 minutes here. This is a good opportunity. I know I'm thank you for that. I want to come back and ask if there is anything that members of this group would like to share or add about what you are currently engaged in, understanding that we have 5.5 minutes. So if there are some things that people would like to, what are we all looking at? Okay. Anything anyone would like to share of importance, work they're doing?
Quickly, at Hunger Free Colorado, in kind of the vein of this meeting, we do a voter poll every 3 years. So 2019 is our, we do it 13, 16, 19. So we're crafting our voter poll over the next couple months, and it'll be done in November. So obviously, if there are issues of like awareness and specific messaging and things like that, we always try to have some of our poll questions around testing messaging to find out what is resonating in Colorado voters. So that's something that I'm currently like mulling over, figuring out, and so I'm excited for that, but also just that I will be kind of gleaning from these meetings. Is there anything that we need to kind of get into that poll? So if anyone wants to talk to me personally, I'm happy to do that.
It's a great poll. I mean, it just gives us such rich information.
Yeah. And if anyone wants to see the data from, our prior polls, like, that's always available as well. So I'm happy to share that.
Another thing related to Hunger Free, your day at the Capitol is on
February 20th. Thank you. So we also do our advocacy day that's centered around hunger, and that's on February 20th, it's a Wednesday, so 8 to 11, and we'll have some great speakers there. We'll be talking, we've had great response around funding for food pantries to get more Colorado products and fresh produce, and so we'll be talking about that as well. And then just an opportunity to be with your legislators and tell them why your work matters and why it's important to you. So we'll have some lobby groups, leaders, people to coach you through who've never done it. I'd really encourage you to come if you're available.
Michelle, what do you say? I just wanted to ask a question, Sheila. Is there, going back to your poll, because I agree with Jennifer that the information that we've gotten and used just on behalf of the friends has been wonderful. I'm wondering if there might be any space in that poll for any understanding about what people think about hunger right now, and sort of like, I know I've seen a lot of great stuff from your poll that's about when you ask them, Coloradans think hunger should be something that our elected officials should care about and should work on. But I'm wondering if there's any space for any sort of baseline conversations about, do you have any idea, kind of getting to, do people even know that hunger is an issue for their neighbor or, families at their school or?
Hold on that a little bit. In general, of like, do you think hunger exists in the state? Do you think it exists in your neighborhood?
Yeah.
And it is true, a lot of people are like, oh yeah, hunger exists, and they're like, but not in my community.
Right.
So I think that there's definitely something to it. But I think with, honestly, with the last couple of years, with the found with a lot, our last poll was November 2016. It was a very, politically heated time. And so I'm curious, for doing a poll 3 years later, how some of that will change, with perception. So
I'm just wondering about it in terms of kind of helping inform this group, thinking about what, is there some sort of statewide level setting we need around hunger and how, and yeah, exactly. I mean, could we wedge ourselves into your poll in terms of getting some good feedback about that so we can make decisions at this table? I know you're not doing this until November, but maybe there's a place for some information back to this group too.
Especially like 1 in 7 kids. Would you believe that 1 in 7 kids is?
Right, exactly. So, okay.
Thank you. Yes, sir.
My employer, Colorado Center on Law and Policy, it has a grant for, a 3-year grant for a SNAP advocate, and we're specifically looking for an attorney. Don't ask me any details, just circle back to me if you know anyone who knows anyone, might want to apply.
May we have that job announcement? You can give
Sure.
that to Kevin so that we can put it out on our
Right.
networks.
Yeah, we haven't posted on our website, we are.
Right. If you could send it to us though, because people don't go to websites that they're not familiar with going to.
No, I will do that.
Excellent, thank you. Yes, ma'am.
Quick question, because this is my first meeting. So when I see building public will and hunger work group, and knowing that there are different models for building public will, have we selected one? Like, is there one in the back of our mind as we do this work?
We have not come to a specific model yet. And that's what some of our work will be going forward is, and my favorite way of being in the world is, Thoreau said, take the road less traveled. My philosophy is take all of them. And so, for right now, I think we are looking at all of them until we figure, where all our paths are best, used to solve this issue. Yes.
I know we're at 12, but I think it'd be nice to see some updates on the implementation director role, and then also hear back on what some of the other workers are doing, just so we're kind of staying in the loop and informed. I feel like I don't have a good grasp on how the blueprint of this whole is moving forward as well. So that's just my last comment I wanted to.
Well, let me take just 2 seconds since it is noon and say that the governing council is going into their third meeting in a couple of weeks. The posting for the implementation director, as you know, has been out. It has its first round of closing on the 15th. The last pieces of information that I recall is that there have been some 25, 50 or so applications that have come in, which is incredibly wonderful. And we're expecting probably in this next little bit a boost since people do sort of wait toward the end of the deadline. But it's been a very robust response. Don't slow down on encouraging people to respond, however. And if that's a quick enough kind of update for you. Okay, yes, sir.
Yeah, and then one thing to add to that, so the governing council, people that have volunteered to be on a subcommittee that does the interviews and selections for that, and they're finding their first time to meet right now. So they'll be meeting within the next couple of weeks. Logistical things, I'm sorry if anybody went to the Colorado Trust this morning. I was updating calendar invites, and I think it got confusing. Next month meeting, March 8th, is actually at the Trust. So it'll be in the basement in the Saban room. April will be in this room, and then the rest of the meetings for the whole rest of the year will be next door in 124 in the bigger room. So, and I also apologize, I know it's kind of cramped in here, but maybe when we meet back here in April, we'll try and open up these tables a little bit and get some more people in the middle here. So, evaluation forms can go to me or Andrew, and then see me for compensation or anything else.
Thank you very much for your ongoing participation.
Thank you. Yeah, if you want to,